We're members of the Central Oklahoma Two-Spirit Society. I'm Corey Tabor, and I'm Creek and Cherokee.
I'm Chad Tabor. I'm also Creek and Cherokee.
And I'm Wade Rensabove. I'm Shawnee, Ponca, Oto, and Sioux.
We've been talking about some things that are impacting our community and some of the issues that are facing us as individuals. And one of those issues is HIV and AIDS awareness in Native American communities right now. And a conversation that we had recently was about how that's affected us as individuals. And what was it that you said the other day?
I did not know anything about Native Americans being positive. I don't know anyone that had been HIV positive or been affected by this, and I have no knowledge of it. And just the other day I had a friend that had came to me and confided in me, telling me that he tested positive not too long ago, and I didn't know how to help him because I didn't know anything about it, and him struggling by himself, I felt sorry for him, and I just felt like I couldn't give him any answers because I did not know anything about it. So I don't know. It still bothers me today. I think about it, and I just don't know how to handle that right now.
I think working with different volunteer organizations around the metro area or Oklahoma City area, that's something that has become more and more important. And I know that as chair of another organization, we really tried to bring some attention to this situation that's definitely heavily impacting the Native community. And we now have March 20th, we observe National Native American HIV/AIDS Awareness Day. And that's just an opportunity to really get the message out in Native communities and via healthcare providers or community outreach members, anyone that we can really use as a vehicle to get that word out there, to get tested, and use those local facilities, whether it's your healthcare provider, whether it's a Native healthcare provider, or whether it's local services like Expressions Outreach Community Center that provides free testing, or in any area you can also dial 211 and get local testing or even mobile testing access. So there are ways to reach out to those people and not only acquire testing and get positive or negative test results, but also receive counseling for that. So there are ways to reach out to people, but people need to know that those services are available to them.
Yeah, one thing you guys both mentioned is kind of like the stigma surrounding HIV and AIDS in Native American communities. And I think in both cases you both touched on points that are relevant to what it's like to be Native American and have to determine, might I be HIV/AIDS positive? These are things that you might want to know. And instead of trying to run from it, it's important to find out. And I think that one of those things is, it's scary to go take that test. It's scary to go find that answer. And I think that, there are a lot of options. You mentioned 211, and then there's like Hope and RAIN in both Tulsa and Oklahoma City. And there's also the Muskogee Creek Nation. They do a mobile testing service, which I think is really fantastic. But I think that more specifically, is that we need to acknowledge that it is in our communities and it does impact all of us as individuals and as a community, because these are our brothers and sisters, and some of them are gay or transgender or heterosexual females, and we are as a whole, as Native Americans, the most heavily impacted racial or ethnic group in the nation right now, like statistically speaking. So I think that it's timely and it's relevant, and I think that as a community, the Central Oklahoma Two-Spirit Society is proud to acknowledge and represent National Native American HIV and AIDS Awareness Day, and we're bringing this public service announcement to you to invite you to get tested and to know your status.
And not only that, but to offer ourselves as a way or point of contact so that you can receive information regarding testing services or counseling services as well.
Thanks for tuning in.
Thanks.